Welcome everyone, Dr. Mandell here with you. Welcome. Hopefully everyone out there is having a beautiful day out there. We are streaming live. Today's topic is costochondritis, rib pain, chest pain, difficulty taking deep breaths, difficulty twisting, turning, difficulty grasping, or we say grasping, reaching out in front of you or lifting your arms up above you. Just twisting in bed, you get that pain in that chest area. Now, many people, you have to obviously be aware that the difference between a heart problem and a chest problem, when it comes down to this the sternocostal area. Let's move right here. Let's see if I can take you to their pictures, give you a little understanding here. Basically, the pain will kind of be over what we call the sternocostal junction, which I'll explain to you and show you in just a second. But generally, when you push pressure on the area, it can be quite tender. It's not going to be inflamed and irritated. There's another condition called tsetse syndrome, which is a little higher up, 1 and 2, but this is primarily the 4 through 6 ribs. And I'm going to explain a little bit the primary reason why we developed this and how we can correct it and things that you need to know to manage this. So if we move up here, we're looking at the Costochondral Junction, and there are 2 areas there. You see the ribs that come around that meet the blue right there. That is the Costochondral Junction where the bone meets the cartilage. Primarily, there becomes an inflammatory condition there, and generally, most doctors will just give you painkillers or NSAIDs, non-steroidal anti-inflammatories, to help reduce the pain. But I'm going to tell you how to help this problem and how to conquer it. Here we see another area. You notice that the pain here, those red little marks there, are a little closer to the sternum. And so this condition can occur at the costosternal junction as well. And so it can happen pretty much, if I come back here a little bit, if I can stand up a little bit, anywhere right off the sternum or even outside the sternum a little bit, okay? It can be either or. That is called that costochondritis. So it's inflammation. We know that there's irritation. And the issue here is, first thing I want to tell you is that we spend time doing this, and you know how I get on all these different tales of people out there from their poor posture with all my videos. That is one reason we can develop this costochondritis. Understand that here's these thoracic spine here, and I'm a big spine guy here. I like to show the models. Here's a normal cervical lordosis, inward C-shaped curve. Here's the outside thoracic kyphosis, normal. But you have the ribs that attach at the vertebral area and the transverse process here. So there's 2 attachments here, and they can wrap around. And when they wrap around, they wrap right into that costal region. And what happens is, when you start developing this particular posture, a lot of that biomechanical changes that take place back here occur up in the front of the chest. So generally what happens is you go to the orthopedist, the doctor, the chiropractor, physiatrist, or any medical doctor, and they only look at this. But what about your posture? What about the mechanics? What about the proper movement? It's like the shoulder. We have what we call the sternal clavicular area here. Guess what? When this sternal clavicular area here is subluxated or fixated where it's not moving, it will affect problems out in the shoulder here. So the problems back in the mid-back area directly affect the front of the chest, because it all works. Because when we take a deep breath, what happens? Our ribs expand, so our lungs can actually take in oxygen, but our ribs are expanding back here too. So if this is not moving or working, you have what they call intercostal nerves, and those nerves run right in between the rib cage and attach in the front, right in front of the chest. So a lot of people will say, I take a deep breath and it hurts, but a lot of it can be coming from the thoracic region. Okay, so I just want to throw that out at you to give you an understanding, because these conditions can go quite chronic. Now, we do see a lot of these conditions in adolescents, many of them. This is more commonly in females and males, probably about 65 to 35% more females than males. And I'm going to base that upon posture, forward head posture, rounded shoulders. That causes everything to kind of sink in and cave in, and we wonder why we're not getting that right articulation, because every time we breathe, those ribs have to expand. And when we go ahead and exhale, those ribs actually come in. They constrict and come in. This is kind of what we're getting all the time. So as those ribs move, like if you cough or sneeze, and you jump to the ceiling, or particularly if you just had a cold, or if you had the flu, or if you had bronchitis, or if you had allergies and you're sneezing a lot, it really, really hurts. And I'm sure a lot of people will leave in the comments below how painful this thing can be, because I've seen many of these. So let's work our way up so we can get through this. There you can see the sternocostal junction there, right there. It's not, I'm sorry, that is the outside. It's not at the sternum. That's primarily at the costal junction where it meets the rib cage, but it can be either or. If we move up here, and the reason why I'm showing this is because, well, my doctor took an x-ray. He couldn't tell me anything. X-rays will not show this. There's nothing on x-ray that's going to show. If you had a significant trauma or you fractured a rib, yeah, you can have pain in the area, but generally, poor posture, overcumulative stresses, looking down, pronated shoulders, sleeping incorrectly, lifting incorrectly, just, trauma, even micro-traumatic type of things can cause this. So x-rays are a waste. X-rays are not going to show anything if there's no fractures. This is a total waste. So I just want you to know that this is not conclusive from x-ray. If you look here, this is the main component of this video. And I can tell you through experience, not only through my patients, but even many, many people here through YouTube worldwide, I have proof of the pudding that these things work. Now, when I say these things, I'm looking at one particular exercise. Generally, when you have contraction of the chest muscle, pronation of the shoulders, the pectoralis minor, the muscles within the chest, they contract, they shorten, they round the shoulder out. And so most people will do what we call door stretches. Let me come back a little bit so you can see my arms. All right. You do door stretches and you take like this and you get in there and you stretch. Now you see my arms right here? This makes it worse. You need to get it high. Okay. If you look at the, let me get a little closer so you can hear me. If you look at the lower pictures there, the letter C, those are the ones you need to do. If you're doing letters A, or let's say your elbows are too low, they're horizontal, or they're too low, you're going to exacerbate that problem. It's just the way the angle works, it's the way the biomechanics works within that particular joint. You do not want to be strictly horizontal like you see it in A or B. You want to be like C. C will help you. That is a key, and very few people ever will do this. And I'm telling you, start doing this. I really think that this will make a huge change. Now, when you do it, you can do one arm at a time, or you can do both arms, but go slow. Don't try to overkill it. But what we want is we want to increase mobility, because when there's lack of mobility, there's lack of function, and you start developing that fixation or those even adhesions in that area, because anything that doesn't move can adhere like glue. So try that. You can, get that hold, maybe about 30, 40 seconds. Do it maybe twice a day. If it's too much pain, then slow down. But that is a great stretch, because you're going to stretch the whole pectoralis unit, the minor and the major, and it's actually going to open up and put motion back into that area, which is going to help regain hopefully better function. A couple of things I want to mention. Moist heat is excellent. Ice, if it's inflamed, use the ice pack. Moist heating pad, you can use it a couple times a day, 20, 30 minutes. Don't burn yourself with it. Moist heat penetrates more than dry heat. You can buy moist heating pads. You can wet it, or some take the moisture out of the ear. If you don't have a moist heating pad, hot baths, hot showers, or even a dry heating pad, it will still help you. I like to use ice in this periodically, particularly if you are working out, if you're stretching, if it's pain after you work out or after you stretch, or let's say you're having a coughing or a sneezing moment and you're and it hurts, you can put ice on it. Ice is never going to hurt it. Only ice about 10 minutes. The other thing is actually good, and you don't see much of it anymore, diathermy. If you look up diathermy, it's like electromagnetic energy, and it builds heat from the inside out. We used to do that a lot in our practice. Even things like light therapy. There are different types of light therapies out there, and I'm not going to just mention like infrared. Infrared is very good. So if you have an infrared unit or a sauna, that is extremely good. Heat is good. Heat brings in circulation. And right in here, I want to mention a couple things. These are very important. Either a good boswellia I like. These are all anti-inflammatories. You can look at this. I like the ginger and the turmeric. There are proteolytic enzymes like right here. Serrapeptase, you can look at my video on serrapeptase. Excellent, helps break down scar tissue. And there are devil's claw and glutathione. There's all different things like the bromelain. And I'm not here to preach or tell you need to take one thing, but I am here to bring this out to the world so you don't live on those NSAIDs, you know, the acetaminophen or the ibuprofens or the naproxens that can actually do a lot of damage to your liver or to your kidney. So the key thing here is education, and that's why we're here today, so we can actually help those people who are in need. And I ask people out there to share this video. I really think it would make a really big change in those that can benefit from this. This is a very nagging, nasty condition. This can go on for a long time. I ask you, if you are a new video viewer here, I ask you to subscribe. Check me out, motivational.com on Facebook. And again, let's continue to stay proactive. I want to thank all our chatters out there for being here with us. But the reason why I posted this today is because I've got so many requests to do this, and hopefully this will really make a big change. In review, make sure when you do that door stretch, get the arm up higher. Don't have it horizontal, and I think that will make a big change. Anyways, blessings to all of you, all the families worldwide. Keep staying proactive. A lot of love to everyone out there, and we'll catch up with you on our next video. Bye-bye now.